You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Thank you. So I just wanted to take this opportunity to give a big thank you to the PM&R Scholars for allowing us to present our program again this year. We're thrilled to have this opportunity, and I want to introduce one of our outstanding chief residents, Kristen Harris, who is going to be giving you some more information about our program. I will be following along in the chat, so if you have any questions, feel free to type them in the chat, and I'll do my best to answer them as we go along.
Hi, everybody. Just give me 1 second while I get our screen share up and going, okay? All right, is everybody able to see that? Okay, so like Dr. Halkowski said, my name is Kristen Harris and I am the administrative chief. I work with Jim Eubanks and Jessica Beardsley, who are two other chief residents who unfortunately couldn't join us today, but who would also be more than happy to answer any questions that might come up. So this is a quick picture of some of our residents. We're a group of 27 in the PGY 2 through 4 class, and then we have 5 residents in the PGY 1 class. This is from one of our biannual retreats, just shows our whole group together. We do have a very distinguished faculty, and I'll talk briefly about them. We are #1 in NIH funding for PM&R departments across the country, which we're very proud of and affords our residents a lot of opportunity to get involved in research. Our faculty is also involved in leadership positions in national organizations, including AAP and AAPM&R, which again gives our residents a great opportunity to follow in their footsteps and get involved as well. And most importantly, they're strongly invested in resident learning and, teach us on the floors, lead after hours journal clubs, et cetera, and spend time with our musculoskeletal ultrasound club. So we're very lucky to have our faculty to learn from. We also have excellence in education. This is a picture of one of our residents presenting at AAPM&R pre-COVID. On average per year, we have 30 resident conference presentations and 10 to 15 original publications per year that are first authored by our residents. And then faculty have over 90 peer-reviewed publications a year. So again, there's just a ton of opportunity to get involved academically if that's something that you're interested in. We also have the research and administrative tracks, which I'll talk a little bit about more later, but that gives residents a chance to delve into their various interests. And our residents hold national leadership positions in AAMC, AAPM&R, AAP, and ACGME. So again, a great way to practice your leadership skills and get involved and foster change on a national level. We do have 4 ACGME accredited fellowships here at UPMC. We have pediatric rehab medicine, we have sports medicine, we have traumatic brain injury and spinal cord injury. And so it's really nice to be able to learn from our peers and also meet residents or fellows who have trained previously at residencies in other parts of the country, which just adds some nice diversity to our group. We also have a value-based fellowship in spine and musculoskeletal medicine, which is starting this year. So we have a new fellow that just started. And again, just takes a sort of an innovative approach to looking at spine and musculoskeletal medicine. So just a quick overview of the residency. So we are not exclusively a categorical or advanced program, which is somewhat unique. So in the PGY 1 year, we have 5 residents who do their intern year at UPMC Mercy, which is where many of our inpatient rehab units are located. And then there is an opportunity for 4 residents to do their intern year at the program of their choosing. So for instance, I did my intern year out of system whereas some of my co-residents did their intern year at UPMC. And so that just offers residents the opportunity to choose what works for them. Looking at PGY 2 to 4, this is just a picture of some of our 2s on the floor with a couple of our attendings. So we have a nice variety of rotations. Like most programs, we kind of start heavier with inpatient rotations and then move to more and more outpatient as residents move through the program. But starting as a PGY2, we already have exposure to EMG, interventional pain, musculoskeletal ultrasound, joint injections. So residents are really getting their hands-on experience from day one, which is awesome. We also have something unique, which is a dedicated research block as a PGY2. And then you have elective time throughout the PGY 3 and 4 years that you could use to put towards research if that's a passion of yours. So as a PGY2, you would have 4 weeks dedicated to work on research, and that can be something from a case report to, first authorship on an article. We have a variety of clinical settings. So I'm not sure if you're familiar with UPMC, but it's a cluster of hospitals that sort of represent the large academic center all the way down to community inpatient setting. So you get a really good chance to see what work can be like after residency. We also have exposure to private practice and then the skilled nursing facility and transitional rehab units. So again, like had been mentioned previously, this is really exciting to get some hands-on practice for what's an important employer after graduating from residency. I think I had mentioned previously, there are a couple of unique program features. So the research track, everybody has that PGY2 month of research. But if you're in the research track, then you have additional protected research time each week. And then you'll have research rotations in the other training years as well. We have mentorship from experienced research faculty. Like I mentioned, UPMC is just absolutely impressive in its research output. And so you have an opportunity to learn from some of the best here if that's something you're involved in. And then you have funding for presentation at national conferences as well. There's the administrative track as well, which is somewhat unique, and that's protected time to learn about fundamentals of administration in a hospital setting. And so we have an administrative lecture series from some of our faculty, and then also protected time to participate in some administrative type activities. And there's a mentored longitudinal project, and those projects have gone on to create lasting change within our residency program, which just speaks to the dedication of our residents involved in that track. Diversity is a priority for UPMC, PM&R, and UPMC as a whole. So we have our CROC, which is a UPMC system-wide initiative, and UPMC is a huge system in general. And then I have a couple of links here to some of our diversity resources at UPMC in general. And there are some dedicated recruitment events as well. If that's something that you're interested in, we're happy to connect you with those resources. There are some great perks to being a resident at UPMC in general. Here, a picture of, this is my class actually when we were PGY2s. And then this was at AAP, the last in-person conference before COVID. So all of our residents have free health insurance, no monthly premiums, which is amazing. There's a meal card that's available at Mercy with varying levels for each year of training. There's financial support for conference attendance if you're presenting a poster or oral presentation. There are education funds each year that are available to spend on books or other educational materials. There's free parking at all of our facilities that's walkable to each of our hospitals. Pittsburgh in general has a low cost of living, and so our salary goes a long way in meeting all of our needs outside of work. And home call is just an amazing benefit. So we take our call from home. There's a graduating system where you have less and less call each year. And then after you have your weekday call, you have a post-call half day. So our residents find that's a great day just to relax and also to get done the things that they need to do outside of work. We have vacation flexibility. So everybody has 15 days of vacation plus a holiday break. And those 15 days can be taken in sort of small chunks if that's something that you prefer. And then last but not least, if you have children, like I know I have a 4-month-old myself, and we have daycare at Mercy, which is a very reasonable rate compared to many daycares across the country. In terms of learning, so we have 5 hours of protected didactics every Wednesday from 7 to noon. And so those are lectures from faculty, and our current academic chief, Jim Eubanks, has done a wonderful job of bringing in faculty lecturers from all over the country. We have workshops extending from peripheral joint injections to cadaver anatomy. We just finished our 8-week curriculum in the cadaver lab where we did some of the dissections. Again, just an amazing opportunity to learn. We have ultrasound workshops, we have spasticity workshops, and then we also have a couple of offsite workshops. So the Human Engineering Research Lab is a Pitt and VA endeavor that focuses on rehabilitation technologies. And then we have some prosthetics and orthotics workshops that happen annually as well. Here are some pictures of some of our residents doing practice, having fun with some of the orthotics. There are a lot of opportunities to volunteer if you become a resident at UPMC. So these are some pictures. We have the Just Ice It event, which is a sled hockey challenge where our residents and faculty challenge the Mighty Penguins. And you can imagine that we are not often the winners of that challenge. We have the Whoosh, which is a wheelchair shoulder health fair, where we can apply our ultrasound skills to look at shoulder health in wheelchair users. You can volunteer at the marathon. There's opportunities for sideline coverage, wheelchair washing day. And not pictured here because it's a new experience is the Birmingham Free Clinic, which provides rehabilitation care to medically underserved communities within Pittsburgh. And so our residents have an opportunity to participate there as well. And last, but I think most importantly, I want to share some pictures of Pittsburgh. So Pittsburgh is just an amazing city to live in. If you're not familiar with it, I was not from Pittsburgh before and didn't really have any ties to the city, but it's just an outstanding place to live. This is a picture of one of our PGY3 residents, Nick Race, who is kayaking in front of Mercy Hospital, where we have many of our rehab units. A picture of the biking path along the rivers of Pittsburgh with many of the bridges. This is a picture for one of our recent graduates' backyard of the sunset over Pittsburgh. This is one of our PGY4s. This is actually just from this weekend. One of our classmates had a birthday and rented a boat for his birthday. We were out on the river enjoying the water. One of our PGY3s playing Frisbee golf, a sport that I had never been familiarized with before coming to Pittsburgh. And then again, another one of our PGY3s getting out and hitting the trails around Pittsburgh. So it's just overall an amazing place to live with lots of different neighborhoods, great food, and a fun city overall. So it's just an excellent place to train. If anybody has any questions, I'm more than happy to answer them. I'm just going to stop sharing my screen so I can see the chat. So I see one question here. Do PGY1s often get to socialize with the PGY2 to 4? So that's a great question. All of the PGY1s have an opportunity to do 1 month with the rehab department. And so there's an automatic chance for them to work with everybody and we get to know them that way. But we also invite them to didactics whenever they're able to participate. We invite them to our retreats so they can get to know everybody. They have an opportunity to do research with the PM&R faculty. So we try to integrate them at every opportunity. Let's see. And I think Dr. Helkowski was kind to offer a lot of these questions for me in the chat. I'll put my email address too. There's a question here about EMR. So we use Cerner EMR across all of UPMC. And so it's nice because it's just the one system. We do use Epic as an outpatient. It's so nice to meet everybody. If you have any other questions, please don't hesitate to email me. I'm more than happy to answer.
All right, we still have 5 more minutes. If there's anything else you guys would like to share, or just for the audience, any last minute questions, we still have time.
We're anticipating a virtual interview season again this year. So we feel like we have a little bit of experience with it now after doing it last year. So we're looking forward to meeting everyone virtually again this year. We're still working out the process, and we'll be updating our website. So I would encourage everyone to check out our website that contains links to our social media. We have our social media residents who are posting fun things about our program that our residents are doing. Sometimes things like a day in the life or meeting our residents. And so just to kind of, I feel like get to know our residents a little bit more, which is something that if you're not able to come for an in-person interview, is really the way to go. I just encourage everyone to take a look at that, to get a little bit more of a personal feel for our residency program and our residents and what they like to do. Also, some things about Pittsburgh. I'm a Pittsburgh native, and I love it there. I think it's the best city to live in the world. And I know for people who haven't been there before, they really should explore online as much as they can about the city because it's a great place to be.
Yeah, follow us on Instagram and Twitter, and you can definitely get a better sense of our program. We like to try to stay active so people can get to know us. Thank you so much, everybody.
Yep. Thanks, everyone. Have a great night.
Yeah,
Look
thank you, Dr. Harris and Holkowski. Thank you so much for your time. Appreciate this.
Yeah, have a great night, everybody.